Just like healthy eating is much harder on a day-to-day basis than it is to just like crash diet, drop like 10 pounds real quick, and then like, of course, gain it back like right after the event is over. That's kind of how this works with survey prep. Hi everybody, this is Mariam Treystman from the Home Health Consultant, and I wanted to talk a little bit about survey prep versus survey readiness in your home health or hospice agency. So one of the important things about surveys is to be ready for them. There are different ways to be ready for a survey, and the two common ones are always be ready or get ready. So there are pros and cons to both, but the biggest pro and con concept out there is that if you have to get ready for a survey, that means that the survey compliance portion of it is not incorporated into your daily processes. So, of course, when a survey is approaching that you know of, an announced or unannounced survey, there will be some effort put, whether you are going into the survey prep or the survey readiness concept, to review everything to make sure that you are in fact compliant, whether you feel that you are compliant or not. So of course, this always starts with some kind of review process. The difference between survey prep and survey readiness is that with survey preparation, you're really holding off a regular assessment of your agency standing, or even incorporating some elements of compliance into your day-to-day structures until it's time to prepare for a survey. And so agencies that rely heavily on survey prep functions will wait until a couple of months before their survey, whatever amount of time, and then we'll start putting together all this paperwork really quickly. As a compliance consultant in the space, I do not recommend this process. Sometimes agencies will hire a consultant to help them with survey prep and put all these things together, maybe trying to catch up on getting some credentials from field staff or, whatever, gathering last minute copy data, whatever it is. While this might carry you over at the desired survey that you're prepping for, the problem with this approach is that if you ever have a complaint survey, or any other kind of like unannounced surprise survey, you're not going to be ready at all because you're not paying attention to your compliance in between. With survey readiness, the agency maintains compliance day to day, regardless of its relation to an approaching survey. In this sense, because the compliance elements are incorporated into your daily processes, there's a lot less emphasis on preparation right before a survey and more on making sure that the compliant process is maintained throughout, years and years, possibly between survey. It's kind of like having a yo-yo dieting concept, or like dieting, nutritionally, dieting right before some kind of event or a vacation, versus a lifestyle change to be healthier in general. So when you start to compare this to eating kind of habits, you start to understand how consistent survey readiness is like the optimal approach, but you can also see how well-meaning companies can fall into a survey prep cycle, because it is much easier to neglect compliance and then catch it up right before an expected survey than it is to essentially incorporate that all of the day-to-day required compliance into your daily into your daily operations, regardless of its relation to a survey. Just like healthy eating is much harder on a day-to-day basis than it is to just like crash diet, drop like 10 pounds real quick, and then like, of course, gain it back like right after the event is over. That's kind of how this works with survey prep. You quickly get into compliance, but then the survey leaves and it's over. So another kind of problematic issue that can arise with survey prep versus survey readiness is that sometimes with active agencies and triennial surveys, if you are being surveyed by an accreditor, CMS actually validates like 1 to 5% of all triennial surveys by either coming with that accreditor or coming back afterwards, sometime after the accreditor has left, and resurveying the agency. When CMS performs these validation surveys, they are surveying you, but their purpose is to check the accrediting company and make sure that they are surveying appropriately because of the potential of unknown surveys, right? So you have announced surveys, unannounced surveys, and then unknown surveys. Because of the potential threat of unknown surveys, it's like an existential threat to your company to be in a survey prep cycle. You really want to get onto that healthy eating plan as soon as possible. Other side effects of kind of trying to do your compliance survey preps yo-yo dieting style versus lifestyle change style is that things like QAPI, value-based purchasing, that essentially pays people more, agencies more or less based on their quality performance outcomes. People who are in the survey readiness, day-to-day compliance kind of boot of this will do better generally on all of their value-based purchasing scores. They will generally be the companies that are submitting all of the data and not having payment reductions and so on. And so these agencies that are really committed to having compliance incorporated as a key component of their procedural day-to-day lives are going to have higher payments, happier patients, less like terror, emergency style occurrences and surveys, less liability events in surveys, less complaint surveys in general, happier referral sources. There's a million reasons to really incorporate this besides the fact that it's the law, separate from that little detail. There's a million reasons to incorporate all the elements of compliance into your agency. And so the question now becomes, how? How do you ensure that you really have all of the compliance elements in your day-to-day really running smoothly? The true answer to this is the hardest part of maintaining excellence in compliance is implementing it and then, of course, maintaining it. But the implementation is really like the toughest part. The reason it's the toughest part is because you don't know what you don't know, and you don't know how to do what you don't know is missing. And sometimes you don't know how to do what is missing, and just law of business, everyone's understaffed. There are very few places that are like staffed appropriately. That goes for supermarkets, that goes for hospitals, that goes for home health and hospice agencies, that goes for government agencies. It takes CDPH, California Department of Public Health, like a year to get your enrollment application just processed, just to get you to a survey. That's because they're understaffed. Similarly, everyone is understaffed. And so the hardest part of a good compliance program is really juggling the resources to ensure that your leadership is providing the proper resources to maintain the compliance activities. That's where we come in. At the Home Health Consultant, our administrative compliance program checks your agency for all conditions of participation, implements all of the important mechanisms, frameworks, and processes you need to manage this stuff. And we do a lot of the legwork for you, meaning we help you with chart audit tools. We can help you diagnose a problem and also find the plan of care for your problem. For example, if you have a fall problem, we can help, number one, identify that you have a fall problem. Number two, give you proven ways that other agencies have solved their falls problems and give you all of the resources around solving them. So for example, elements you need to incorporate into your in-services for this exact solution, chart audit tools that you need to incorporate into your daily life of chart auditing to ensure that you're maintaining compliance with these standards, and so on. Replicating these processes across your whole organization. In this sense, we help relieve about 90% of the administrative burden of maintaining a proper compliance program. But we are not the only way you could do this. Just, putting all bias aside, I think we are the easiest way for companies to do this, because it's very hard to get that information. It's very hard to understand what's required of you, understand how to implement this into like actual procedures and daily processes, to adapt policies to your actual life processes and not just like have them be some book on some shelf forever and things like that. If you're struggling with this, please give us a call. But there are other ways to maintain compliance. One way, and of course this is the regulatory requirement, is make sure your administrator and DPCS are like very actively involved, really know what they're doing, really keep up with the regulations and so on. But sometimes these professionals can lose touch with requirements as they change and things like that. And that's why working with a consultant really helps. Sometimes they're really busy with a lot more hands-on kind of day-to-day stuff and a lot less on the administrative side. There's a million reasons why your DPCS and your administrator could be like very strong, let's say, in one area and like not. It's just people, right? Like, so sometimes people are good at something, not good at other things. For whatever reason, or maybe you're like between administrators, like one left and now new one's coming in, and so your whole system kind of changes. So what our process does is it maintains continuity in your agency's operations regardless of these structural changes or who comes in and out, what their skill set is. We're kind of an administrator's assistant, so we're a supplement to these positions and not in any way a replacement. We help them reduce their workload so that they, on these like kind of bureaucratic and administrative practices, so that they can focus on the things that they're, first of all, probably prioritizing anyways, if you are understaffed. Another way of maintaining a compliance program is there are some softwares out there, things like that, but that's still in the DIY territory. And so it's still on your agency and internal staff of the agency to evaluate your agency for compliance with all the regulations, constantly maintain the processes and so on. So what we try to help you do is we hold your agency accountable to your progress, essentially. And so that is really the difference between survey prep and survey readiness. Of course, maybe we're a little biased, but we have 1,000 reasons that we can recommend incorporate, like for the first and foremost one is that's the law, to incorporate excellence and compliance on a daily basis. And it's a lot less work than you think it is when you go through our system. And the positive benefits are just like, you can't overstate them. So those are the differences between survey prep and survey readiness, and a couple of approaches on how you can initiate or start or maintain a compliance program. So if you enjoyed this video, please like, share, subscribe for more of our content. And again, this is Mariam Treystman from the Home Health Consultant. Thank you. Bye.